Next up, we've got Dr. Cora Doherty, who is a consultant neonatologist at the University Hospital of Wales in Cardiff, and a member of the Executive Committee of the British Association of Perinatal Medicine. She chaired the group that developed the British Association of Perinatal Medicine framework for practice on lactation and loss, and is going to talk to us today about this framework. And I believe Cora's connections to Ireland, so welcome back to Ireland, Cora.
Thank you. Thanks so much, Justin. And thank you very much to Tanya for inviting me here today to speak about this really, really important subject. And, you know, before starting to explain to go through the with people, I just want to say that it was been an absolute honor to be leading this framework with such a fantastic team, and I hope that it will be shared far and wide so that we can really highlight the importance of this work. So first question really is well, how did all this start? And it related really to, I've always been interested in breastfeeding, but my own experience with a mother whose baby died one night on the neonatal unit. And I just wanted to go back to the fact that if we look at a high quality service, you have to, in order to deliver this, you have to have the best evidence available. You want to reduce waste, reduce harm, and reduce variation. And that service should be provided to the right person in the right place at the right time, alongside good communication between teams. And clearly with you know, lactation and loss and management of this in the clinical setting, there is often a lack of knowledge and information. There's variation across services, and different services, particularly say that the milk banks and the hospitals, may not necessarily be joined up. And alongside this, there are pockets of really, really good practice, which we wanted to really hone in and look at the evidence when we were embarking on this journey. So the lactation loss framework is made up of a number of different sections. Who is it for? There's information about loss. There's a section on the physiology of lactation. And we felt it was really important to include that for, Emma will go through this later, but for specific reasons. And they were related to the timing of death and the stage of lactogenesis or lactation that a mother was in. We've covered end-of-life considerations, social and cultural considerations, and that includes the impact on the family, the wider impact on the family in relation to lactation and loss. It's not just about the mother, as Tanya had alluded to earlier. And then the practicalities then of managing lactation after loss in relation to the cessation of lactation, plans for reduction in milk production, and then non-pharmacological management, or management without using any medication to suppress lactation, and then pharmacological management or medication which can be used to suppress lactation should a mother choose to go down that route. And then on the flip side of this, then there is the continuation of lactation. And we talk about the management of this within the document, and this is continuation could be in relation to the fact that the mother is just gradually reducing her expressing time. So she will have additional milk, particularly if she was in lactogenesis stage 3 at the time that a baby or a child has died. It may well be that there's a twin who has survived, and that mother has either got to start establishing lactation or has already got established lactation, or the mother may be feeding an older child, breastfeeding an older child at the time of death. And we consider what can happen as well as continuing to feed another child. What are the possibilities around donation? How is that organised when a baby dies? And also there's a little section about research as well. I just want to say about research that is really, really important area that we need to focus on going forward as we continue to highlight this important area. And then we talk about the practicalities again, which are about planning the milk donation, the context, where to go, who to get information from, and how to go about doing it. And the aim is to expand this to Ireland and to elsewhere so that we have a much more global reach in relation to this document. There's practical information about supporting families, and then also how to have conversations with mothers, how to start those conversations. And we've also provided some templates for discussions as well. And many departments might choose to have some role play around those discussions. Unfortunately, I'm not going to be able to go through all of that in the whole document today with that information, but it is freely available in the document. So, who is the framework for? Well, it's intended for professionals who are working with parents and family to facilitate them to provide information and guidance in supporting mothers around lactation or loss when a baby or a child is not expected to survive or who has died. And because this is a framework from the British Association of Perinatal Medicine, it's focused mainly around perinatal and neonatal death. But we've remained very mindful that mothers may be breastfeeding when they lose an older infant or a child. And it also, as I've mentioned, provides the information around support for partners and families. And for those of you who are interested, we will have a parent information leaflet coming along, which will be tagged to this framework to help support to provide for parents at the time when this framework is being used. So then just this is the overview then of the document itself. So we cover a section on lactation and loss. We talk about the death of a baby, and the subsequent grief is incredibly complex. And whilst there is emotional pain and physical pain associated with grief and bereavement, there is also the physical pain associated with lactation. And if you look at the parent stories, there's a specific story about a mother having to express after her baby dies when the police come to the house, and there's her baby is being cared for following death. And it's really, really heart-wrenching story to read. Mothers often they no longer feel a need to provide comfort and nutrition for the baby. And this whole situation may be overlooked, which can significantly impact on maternal, emotional and physical well-being. It's important also, when we're dealing with lactation and loss and mothers, is to consider individual circumstances. And Tanya is an expert on all of this, but there's the idea of the continuing bonds theory and the legacy if mothers continue to express milk. There is the knowledge that other babies may be supported, and other mothers may feel that it's a reminder and they just wish to suppress. So everybody is different, and taking that into account and being there to guide people as opposed to make decisions for them is really, really important. So listening is really important in this situation. Now, in relation to staff, they're often really busy around planning for, if there's planning for death or around when a baby has died, they're undertaking multiple tasks, they're supporting the family, they have paperwork and administration or IT work, and they may not have had any training in lactation and loss. And there may not be clear guidance on managing either cessation or continuation and donation within their organisation. And it's important, therefore, to provide education and guidance for staff. And this would include the stages of lactation and lactogenesis if necessary. And one of the reasons people looking at this may say, well, those of us who are dealing with breastfeeding, we understand, we are very clearly knowledgeable about the stages of lactogenesis, but we felt it was really important for people who may be starting at a sort of a lower level and wish to obtain that information, because it's really important to understand lactogenesis when approaching mothers and families. So in relation to that, and I know Emma's going to talk about this in a lot more detail, knowledge of the stage of lactogenesis is really, really important, because death can occur at many stages in the perinatal period and beyond. So a mother may have a stillbirth where a baby has died before or during birth, and that is known. The stage of lactogenesis that mother will be at will be lactogenesis 1, where there's just small amounts of milk being produced and colostrum. And this will have been going on for a number of weeks already during the pregnancy. And the mother may already be aware that she is producing some milk. Early loss then is defined as a baby who dies within the first few days, and this is related temporally to lactogenesis 2, where the milk has started to come in, there's more milk, and the mother is clearly establishing her breastfeeding. And then later loss is when a baby dies after at least the first week, and this can include older children. And in that stage, it's known as lactogenesis 3, where lactation breastfeeding is well established. And then it's really important that we take into account if there's been a multiple pregnancy with a surviving baby, or where there's an older sibling being breastfed, and that could cover stages 1, 2, 3. So managing lactation after loss, therefore, is going to be dependent on a number of different variables, the timing and the route that mothers and families choose to take. So it may be that the mother has had a stillbirth and she decides that she either wants to not establish any breastfeeding, or that she wants to start breastfeeding. And we had a great talk by a mother at our BAPM webinar the other day who had a stillbirth and established lactation. So clearly supporting that mother through that stage, through the stage like you would support a mother whose baby was alive, with going through the ways of expressing to improve milk production in the first few days following the delivery of a baby or following a stillbirth, is really, really important. Considerations and variables that also impact on this is whether the death has been an expected death and planned, or whether it was unexpected and very, very sudden. And that varies when you have time to, we know, planning, parallel planning or planning palliative care. We often have days or weeks in order to plan that, and there can be lots and lots of conversations take place with parents. If something happens suddenly, it's often easy to forget about having those conversations, but they're also incredibly important. And then those discussions should take place around continuation or establishment of lactation, or whether mother wants to cease lactating or to suppress lactation. And special consideration is really important if a mother's already feeding another child, or if there's a twin pregnancy. And then finally, as I've mentioned before, culture, family, and social situation are incredibly important to consider. Now, if we then look at lactation itself and managing, as I've mentioned, there's either the sort of lactation cessation pathway or the lactation continuation pathway. I know they're big words, so it's either stopping lactation or continuing lactation. So in relation to stopping lactation, we can use pharmacological or non-pharmacological methods. And when non-pharmacological or non-medication methods are used, it's important to understand mothers as individuals, take into account their culture and family practices. And there are many different cultural practices that take place around stopping cessation when a baby is born. Homeopathy may be used. There isn't huge evidence for this, but it's important to respect wishes. And around cessation, there will be, depending again on the stage of lactogenesis, there will be gradual reduction in expressing, and working out a regime is really important. And there's an example of this given in the appendices of the document. It's also important to remain mindful of painful engorgement and mastitis, and whether this can be measured managed in a non-pharmacological way, or whether a mother will need treatment. So simple things in relation to no medical management for cessation are positioning, such as lying on the back, the clothing that the mother wears in relation to undergarments, the use of cabbage leaves, some evidence that they ease the pain, cold compresses. Some mothers may want warmth, simple analgesia, And then again, another example of cultural practices, which is breast binding. And when we then look at pharmacological or medical support for lactation cessation or stopping, what we're advising in this document is cabergoline. This is a dopamine agonist. It inhibits prolactin, and this has previously been shown to suppress lactation in over 90% of women. And again, going back to the stages of lactation or lactogenesis, these are really, really important because the cabergoline dose that's used or the treatment regime will depend on what stage of lactogenesis a mother is in. It's important to remember that cabergoline does have side effects, and it's important to counsel regarding the potential for these, not only because they might happen, but also because associated with grief, as I mentioned, there can be often physiological changes associated with this. And sometimes it could be difficult for a mother to work out what's happening with her body. But if she knows that these side effects can be associated with cabergoline, well, then that could be, in a sense, some reassurance if you're feeling some unusual side effects. In relation to cabergoline, it's also really important that each maternity and neonatal service should look at how best to facilitate prescription and supply, and that there's an agreed pathway of this with very clear guidance. And the person who's prescribing should be the clinician looking after the mother. And I've heard stories and certainly experienced it in our own unit where we've been requested to write up this medication for the mother. And because of the significant side effects, and we have to take into account if the mother has cardiovascular disease or something else, it's really, really important that this is the person prescribing is the one looking after the mother. So then following, a mother may choose to stop lactating or go down the other pathway, as I've mentioned, of continuing lactation. And continuation of lactation may be related to a mother may well be expressing less as part of her gradual suppression of lactation. So even if her decision has been to stop lactation, she will still be producing milk on that journey as she gradually reduces her expressing times. Other mothers may choose to continue to express milk in the longer term. And as Tanya has again mentioned, sharing of maternal milk is really steeped in history with cross-feeding and wet nursing. And in many societies, this is still happening today. And there's also the knowledge that the milk produced can help a baby in need, and it could be a legacy left by a child. And if any of you attended the BAPM webinar last week, you will remember Nick Embledon talking about milk really as being a living organism, which it is, containing plenty of cells and antibodies. So it's not just a form of nutrition. In relation to continuing of lactation, again, even if a mother has decided to have stop expressing following the death of the baby, she may have a freezer full of milk on a neonatal unit or within the fridge. And it's important to also discuss what happens and what the mother's and the family's wishes are around that frozen or refrigerated breast milk. For teams exploring possibility of donation, we make it really clear in the document that looking at what are your options for donating before talking to a mother is really, really important. And I hope with the way everything's expanding, that finding milk banks to donate is going to be easy. But in the past, there's certainly been instances where mothers have asked to donate that's been agreed, and then there hasn't been a facility for them to donate. And again, there are a number of options in the framework about how to donate, what are the contraindications, and then other options in relation to donation, such as jewellery or keepsakes, or even research for continuing lactation. And this is just an example of a keepsake that can be made out of breast milk, and we give some others on the framework. One thing I did want to discuss before, and I'm mindful of time now, is the Forever acronym that we have developed as part of the framework. And this is framework, really within a framework, to support staff approaching families to have discussions. And there's some clear conversation starters, but this provides a way for teams to explore themselves of how they're going to set up this framework within their own organization. So Forever stands for, F is for families, and it's around recognizing the importance of input from families and the support for the mother in any of these decisions and discussions around lactation. O is for open discussion, to start exploring these feelings, to have no silos around this. And it might be considered by many people to be a tricky subject, but the more we talk about it, the easier it's going to become. To revisit, to be prepared to review and have ongoing conversations on feelings and thoughts, because when this is first brought up, it might be quite confusing, or for mothers, they may not have considered it. Other mothers may have had lots of time to think about it and have some ideas about how they want to go forward. And then exploring and explaining the different options available within a particular service is really, really important. So if you're planning for cessation, talking about reduction, if you're planning to continuation, how those conversations would be structured. It's really important in all of this to validate the mother and the family so that they feel heard and understood, irrespective of what decisions or what opinions they are bringing up. Empathize goes without saying that this is really, really important. And then finally, continue to respect and review the decision that mothers and partners have made, with an appreciation as to how their values and beliefs affect those decisions. So I'm just going to go on now. Within the document, we have some parent stories, and these are incredibly powerful. And I just wanted to give people watching a minute or so just to read these stories. Just going to go on to the next one now. And I hope they bring home, those stories bring home the power about this document and how important it is that we have it. And finally, I'd just like to thank all of the team for the input and all the reviewers. We had 156 comments on this. We have more comments have been coming in today through to the BAPM office. I'm really, really grateful to all the parents who've contributed to this, both to the framework and those who contributed to the BAPM webinar last week. And finally, to thank the BAPM office team who've been fantastic in the background, doing the formatting and the editing of all this. Thank you very much. And thank you to Tanya for inviting me here today.